Prostate enlargement, also known as benign prostatic hyperplasia, is a common condition that affects many men as they age. The word benign means it is basically the non-cancerous growth of prostate cells. The prostate is located below the bladder and surrounds the urethra, the tube that carries urine out of the body. As the prostate increases in size, it begins to squeeze the urethra, leading to a number of symptoms, such as difficulty emptying the bladder, trouble initiating urination, frequent urination, involuntary leakage of urine before or after urination, and sometimes even blood in urine. Studies showed that the risk of developing BPH or prostate enlargement increases with age. It has been estimated that BPH affects over 8% of men in their 40s, 25% of men in their 50s, over 50% of men in their 60s, and over 80% of men in their 70s and 80s. But don't worry. In today's episode, let's learn about some of the best fruits to help shrink an enlarged prostate. Let's begin. Number 1. Watermelon. Watermelon contains a powerful antioxidant called lycopene, the same pigment that gives its flesh the red color. Studies show that lycopene helps to reduce inflammation in the prostate and may even protect against prostate cancer. In fact, a 2011 study published in the International Journal of Urology found that men with BPH who took 25 milligrams of lycopene daily for 6 months noticed up to 17.2% increase in peak urinary flow rate and up to 7.2% reduction in their prostate size. Red-fleshed watermelons contain up to 18 milligrams of lycopene per cup, which is roughly 152 grams. So you can easily get enough lycopene from just 2 servings of watermelon every day. Another beneficial compound in watermelon is citrulline. Our body converts this compound into L-arginine, which helps our body make more nitric oxide. Now this nitric oxide helps to dilate and widen your blood vessels, leading to smooth blood flow to all parts of your body, including your prostate, of course. This can help relieve your symptoms of BPH, including erectile dysfunction. In fact, one 2018 study showed that citrulline supplementation improved erectile function in men with BPH. Number 2. Berries. Berries, including strawberries, blueberries, raspberries, and blackberries, contain anthocyanins, which are mainly responsible for their vibrant colors. These compounds have been shown to have anti-inflammatory and antioxidant properties that can help protect against prostate cancer and BPH development. In fact, a 2019 study showed that a high intake of blueberries was associated with up to 24% lower risk of BPH in men. For the record, blueberries contain the highest amount of anthocyanins among all other varieties. Another compound present in berries, particularly raspberries, strawberries, cranberries, and blackberries, is ellagic acid. This compound has been shown to have anti-proliferative and anti-inflammatory effects, which means it can potentially inhibit the growth of prostate cells and prevent BPH progression. In fact, a 2020 review of studies showed that ellagic acid, along with other bioactive compounds in berries, showed promising potential for prostate cancer prevention and treatment. Berries are also a good source of vitamin C. One 2011 study showed that a high intake of vitamin C was associated with up to 26% lower risk of BPH in men. So, if you are looking for the best fruits to help shrink an enlarged prostate, berries can be a pretty healthy option. Number 3. Citrus fruits. Citrus fruits like oranges, lemons, limes, and grapefruits are a great source of vitamin C and limonoids. Vitamin C is a powerful antioxidant and has anti-inflammatory properties, which help protect your prostate cells from free radical damage and reduce inflammation in them. This can potentially inhibit prostate cell growth and relieve BPH symptoms. One particular research involving over 12,000 men showed that people who took vitamin C supplements regularly had a lower risk of developing BPH and prostate cancer than those who didn't. Limonoids in citrus fruits, particularly lemons, have also been shown to have anti-cancer properties. But remember that taking too much vitamin C from citrus fruits or supplements can also increase your risk of getting kidney stones. So be careful and consult your healthcare expert about that, especially if you have BPH, kidney disease, or other health conditions associated with them. Number 4. Pomegranates. Pomegranates contain punicalagin, ellagic acid, and urolithin A. Punicalagin is the most abundant and powerful antioxidant in pomegranates. It has been shown to have anti-inflammatory, anti-proliferative, and anti-angiogenic properties, which means it can potentially reduce inflammation in the prostate, helping to relieve BPH symptoms, and may even inhibit prostate cell growth. In fact, a 2005 study showed that punicalagin inhibited the growth of prostate cancer cells by up to 50%. How amazing is that? Ellagic acid, according to a 2007 study, can inhibit the growth of prostate cancer cells by up to 35%. Some clinical studies showed that pomegranate extract reduced PSA levels by 13% and improved urinary symptoms in men with BPH, with a 52% reduction in nighttime urination frequency. PSA is basically a protein produced by prostate cells, and its high levels indicate a higher risk of prostate cancer, BPH or enlarged prostate, and prostatitis, a severe kind of prostate inflammation. So when you eat pomegranates or drink pomegranate juice regularly, it cannot just reduce your risk of prostate cancer, but can also help shrink an enlarged prostate and relieve its symptoms. Number 5. Avocados. Avocados contain beta-sitosterol, carotenoids, vitamin E, and monounsaturated fats, which are healthier kinds of fats. Beta-sitosterol has been particularly shown to be very effective against symptoms of BPH or enlarged prostate. Research suggests that 60 to 130 milligrams of beta-sitosterol can be extremely effective in treating BPH, and on average, one medium-sized avocado can provide about 132 milligrams of beta-sitosterol. One 2002 study involving BPH patients showed that men who took beta-sitosterol noticed up to 20% improvement in urinary flow rate and up to 7% reduction in their prostate size. Another study showed that men who took 30 milliliters of avocado oil daily for 3 months experienced significant relief from urinary tract symptoms associated with BPH. Other compounds in avocados like lutein, beta-carotene, vitamin E, and healthy fats can further help reduce your risk of developing BPH, prostate cancer, and urinary symptoms associated with them. But remember that avocados are calorie-dense, so do not eat them too much. Consult your healthcare expert before making significant dietary changes, especially if you have underlying health conditions. Number 6. Tomato. Tomatoes, particularly cooked tomatoes, are rich in a potent antioxidant called lycopene, which has been extensively studied for its potential benefits in preventing and managing prostate health issues like benign prostatic hyperplasia and prostate cancer. According to a study, men with the highest lycopene intake had up to 25% lower risk of prostate cancer and up to 44% lower risk of other cancers. Another study showed that men who consumed 2 servings of tomato sauce per week experienced a 20% reduced risk of BPH progression compared to those consuming less than 1 serving per week. Another fact is that the amount of lycopene is higher in cooked tomatoes than in raw tomatoes. 1 cup, or 149 grams of raw tomatoes, provides approximately 2.3 milligrams of lycopene, while processed tomato products like tomato sauce, ketchup, and tomato paste are even richer in lycopene, with 1 cup of tomato sauce containing around 23 milligrams. Number 7. Mangoes. Mangoes are more than just a delightful treat for your taste buds. This tropical fruit holds surprising health benefits for various parts of your body, including your lungs, colon, and most importantly, your prostate. They contain vitamin C, beta-carotene, which our body converts into vitamin A, and another special compound called lutein. Both vitamin C and vitamin A have powerful antioxidant properties, so they can protect your prostate from free radical damage and reduce your risk of developing BPH or prostate cancer in the first place. While lutein in mangoes has been shown to have anti-inflammatory and anti-cancer properties, which means it can potentially prevent your prostate cells from multiplying too much. But remember that eating mangoes and other foods mentioned in this video is not at all the prescribed way to treat BPH. Always consult with your healthcare expert for proper treatment and diagnosis of BPH, enlarged prostate, prostate cancer, and urinary symptoms associated with them. But you can get additional help from these fruits by making them a part of a balanced diet to speed up your recovery process and shrink an enlarged prostate. Make sure to like this video, and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.